Welcome to Swine Time with Pipestone. I'm your host, Dr. Spencer Wayne. Thanks for tuning in. Swine Time podcast was created for the pork industry and individual pork producers around the country, so make sure to bookmark this page to make sure you're fully informed regarding pork industry news, advancements in animal care, and how to enhance your productivity. Welcome to Swine Time. All right, I'd like to welcome our guest today, Dr. Joseph Yaros. Joseph is going to talk to us in a two-part podcast session. The first session right now we'll talk about herd level disease elimination, and the second podcast session will focus on bigger picture disease elimination questions. Joseph is one of our newer veterinarians, but he's been here through 3 years. How long
3 years now.
3 years.
Goes by fast.
Yeah, and Joseph is not a local native Midwest guy, so in my mind he's still a foreigner, kind of, maybe a little bit, although I kid him all the time, and I shouldn't. Joseph graduated from Cornell, correct?
Correct.
New Yorker.
Correct.
All right, but you've adapted well to Midwest ways, so we've welcomed you as now a native son. So the topic today, Joseph, jumping right into it, herd closures and herd level disease elimination. As we kind of got ready for this, you and I decided let's split this up into two, and the first one being herd level disease elimination. These are things we've done at our herds now and that are, I would say, commonly done to truly get rid of a disease at a farm level, not a regional level or a national level, but at a farm level. So, Joseph, you have spearheaded, for sure, mycoplasma elimination, but you're familiar with all the things we've done for different diseases. Can you kind of jump into a little bit and just describe, if we have whatever disease on a farm, how we might get rid of it, the method for that? And you could pick one disease and start with that and go to the next, but just an explanation for how we do these disease eliminations at the farm level.
Yeah, without a doubt, Spencer. So when I think of a closure or an elimination for a pathogen, I'm usually thinking of one of three different pathogens that may be infecting a sow herd today, and those might be PRRS, PED, and then mycoplasma. And with that, each of them have a slightly different process for getting everyone exposed to the pathogen, so they're showing clinical signs, but the main idea would be to focus on three separate things: load, close, and homogenize. So the idea behind that is bring in enough animals for the entire duration of which that pathogen is going to infect that animal before it goes out of their system. Close the herd so you don't bring in any new animals to the herd during that entire time span. And then homogenize, you want to make sure everyone's experiencing that health pressure at the same time so they can all go through it. And I like to use the analogy of a fire myself. So imagine you got a fire and the fire is continuing to burn, and the thing a fire needs is both oxygen and more fuel. And if you take away either of those things, in this situation, the fuel would be more pigs to get infected, then you're going to stop that infectious process from spreading through the herd, and it's going to be on the path of elimination.
Yeah, I use the same analogy. So I think you could close a herd, as we call it, by loading it up, and then you're relying upon time, because you're basically letting that fire burn out. And the way you can make a fire burn out quicker is to get it all lit faster. And so we're exposing for that. Then we give them time, and then those embers are eventually turn into ashes. And then basically the pathogen is gone, should be truly gone. And then we reload with fresh firewood, but no fire. And so that's I think that's the best way to explain it. Kind of breaking those apart. If we're thinking of that load, close, and homogenize process, you've got immunity, you've got basically things like antibiotics maybe to knock it down, and then you've got time is the essence, the essential pieces of putting it together for a disease elimination. Can you maybe go through how that might work regarding time and or everything, the process of exposing them? Take us through a step-by-step of, in big picture terms or broad terms, of what a sow unit might go through.
Yeah, and so if we know that for example, I'm going to use the example of PRRS. If we rake with a PRRS virus in our sow farm, you're going to see the clinical signs that everyone knows and understands for the virus. Piglets are going to be falling back, have a higher pre-wean mortality, increase in mummies, abortions, hard breeding, sick sows. You're going to see a range of all of it. And with that, after you understand exactly what it is that you're dealing with, you're going to have to bring in enough animals for an entire period for that virus to stop circulating in those pigs if they get infected. And it's kind of interesting, Spencer. We kind of lucked out in a sense that these viruses, or this virus, generally takes somewhere in the neighborhood of about 250 days. And if we think about the amount of time that a gilt's going to be growing up in a GDU, it just happens to be a little bit longer than that. So we're very fortunate that a number of these pathogens actually kind of perfectly play to how exactly our barns and GDUs are outlined. But you're going to, after you bring in enough animals for that entire 250-day period, expose them all at once, generally through utilizing serum that's going to contain that virus, and then do whatever we can after we expose everyone at the same time to decrease that virus from circulating in the herd. But generally about 250 days later, some might take a little bit longer just based on the virus. You're going to be ending up with ideally a negative herd.
Okay, so you described it pretty well. You need 250 days time, you load the herd up. One thing you didn't mention, which is probably worth mentioning, is how you know if you're successful. And as we get towards the end of these things, we test, but I don't know, that's probably floated around what the best way to test is. If just to confirm we're doing it right, we should be testing pigs, or how would you do it to confirm?
That's a great question, Spencer. And you know what? I'm honestly going to plug a second podcast for us to follow this one up with, because doing diagnostics and testing for PRRS, I think you could have a number of different episodes about that. But I would just give an overview and say some of the main methods people have now would be bleeding individual pigs, maybe taking some processing fluids from pigs when they're getting processed at an early age, maybe doing oral pharyngeal swabs or some ropes on pigs. There's many different options out there.
Okay, suffice it to say we can test for it to gauge our success, at least very well with PRRS or PED. Another question, though, is success rate. I know that'll come up when you're talking to producers. Is this going to work, is the question. So for PRRS, PED, or mycoplasma, what do you think the rough success rate is for each of those? If you're trying to get rid of it, can we really do it or not? What's the chance of success?
Yeah, that's a great question. Guess kind of depends how thorough your exposure was. Some viruses act a little bit different than others, but I would say, in general, you're going to have a 80+% success rate, and that's honestly probably low.
Okay, with PRRS or all of them?
Well, it depends who you're hiring.
Okay. Well, my personal opinion is that you've got mycoplasma taking a little bit, maybe longer, or having a lower success rate. So I'd say mycoplasma is a little tougher. I've had personally more failures with that to successfully get rid of it. PRRS seems more straightforward, but again, not perfect. So let's say 80%. So none of these methods are perfect, and you're going to fail on a few of them. Fair enough?
There's always risks.
Okay.
There's always risks in life.
Okay, well, that's probably enough time spent on this. We haven't beat it up totally, but we covered some of the basic points. That's it. Any other comments, Joseph, you have on the individual herd elimination of disease?
No other comments on this. Looking forward to our next follow-up podcast, and I really just want to say, Joe Rogan, watch out, we're coming for you.
Yeah, okay. Well, thanks, Joseph. I appreciate your insight on herd-level disease elimination, how we do it, at least here at Pipestone. To our listeners, remember to subscribe to our podcast to get the latest Swine Time with Pipestone. You can find us on Spotify, iTunes, Google Music app, and your favorite podcast platform, and of course our website, pipebed.com. Join us next time for Swine Time Podcast.